Spinal cord injuries provoke serious movement disorder that in many cases require technical aids to compensate all this so important motor function disorder. Biomechanics is a multidisciplinary area of knowledge. It represents a tool that can give us not only quantitative information of the movement disorder, but biomechanics can also generate new technology that allow us to design new devices to compensate or rehabilitate this movement disorder. The first topic for us is to give information, to give support for the clinicians, for the patients. So in our lab we make gait analysis, and also we made any other test to select the most adequate cushion for the patient. And these two proofs are we are working in this area to give, I told you, clinical support. We also have specific research lines. We have two specific research lines, like movement analysis and evaluation of technical aids. The movement analysis, we are making gait analysis. We made manual wheelchair propulsion analysis. We also analyze the activities of daily living, and we are working analyzing these activities, and we also are working in all the processing of the data. We are working in binary data because for us it's very important not only to see how the movement is being done, but also to get quantitative information. In many cases, the information is very difficult to be read because the many data. So we are working getting new index from this data. More recently, this gait analysis, we are working to introduce this analysis to the design of robotic devices like exoskeleton for upper and lower limbs, and also the movement analysis. We are introducing the movement analysis in the design of virtual reality devices like Toira. We have developed a virtual reality tool in this hospital named Toira, which is a tool that tries to improve the upper limb rehabilitation in people with spinal cord injury, mainly in people with cervical spinal cord injury. Well, we had good results defining specific gait patterns in incomplete spinal cord injury, like central cord syndrome, like Brown-Sequard. We have defined how this kind of pattern, how this patient can walk. We have also developed an equipment to study the manual wheelchair propulsion, and we have developed also a biomechanical model for upper limbs. This is very interesting, and we have good results of the forces and the moment of forces in each upper limb joints, considering the different levels of injury. Also, we are very proud of we have developed the control strategy of the hybrid exoskeletons. Hybrid exoskeletons are exoskeletons, wearable robots that can compensate the gait, the function. We have good results in the control strategy. When the actuators of the exoskeleton works, and when the FES, I mean the functional electric stimulation, works to restore the gait function. We have developed, I told you before, a system based on virtual reality. It's named Toira. It's a system to improve the rehabilitation of the upper limb motor deficits in spinal cord injury patients. And this system allowed us to rehabilitate the upper limb deficits, and also to obtain quantitative information how the patients perform their activities of daily living. And also this device allowed us to design long distance treatment. So the patient when the patient is treated at home, we can get the information of how the patient is doing their rehabilitation. We are working together with three main groups in the States. In the States, we are working with Professor Rory Cooper in Pittsburgh University, especially mainly for the design of the upper limb biomechanical model for manual wheelchair propulsion. Also, we are working with Professor Mehta Nakaya from the University of Houston. He is giving us the support for the engineering devices of the development. And in Spain, we are working very closely with the bioengineering group of CSIC. The leader is Professor José Luis Pons.